Communication and involving you. I have the right to be informed about and involved in decisions about healthcare and health services. Communication and information. I have the right to ask questions about my care and treatment. I have the right to clear and open communication about my care and treatment from NHS staff. NHS staff should introduce themselves to me, and I should be told the names of the staff responsible for my care and how to contact them. I can let my healthcare team know what matters to me, and they should take this into account when discussing my treatment options. I have the right to receive adequate information about the care and treatment available to me, including what it will involve, whether it is really needed, what are the risks, benefits, side effects, and alternative options, and what might happen if I choose not to have the treatment. I should be given information about my treatment and care in a way I can understand, and in a format or language that meets my needs. For example, in audio format, Braille, British Sign Language, or in a language other than English. NHS staff must check whether I have understood the information they have given me, and whether I would like more information. I can ask NHS staff to provide more information about my condition, treatment, or care. I can ask NHS staff to explain anything I do not understand about my condition, treatment, or care, including any words I do not understand. Communication support. I have the right to be provided with communication equipment and the support I need to help me use that equipment, in health services, hospital, the community, or at home. I can find more information on how communication equipment and support are provided from Part 4 of the Health, Tobacco, Nicotine, etc. and Care Scotland Act 2016 on the UK legislation website, www.legislation.gov.uk/ASP/2016/14/contents/enacted. Guidance on the definitions of communication equipment and support, easy read version, on the Scottish Government website, www.gov.scot/publications/guidance-provision-equipment-support-using-equipment/. NHS staff can arrange support, such as an interpreter, if I let them know beforehand. I can ask NHS staff to arrange a longer appointment for me if I plan to use an interpreter or other communication support, such as augmentative and alternative communication, AAC. I must let them know my needs before any appointments. If English isn't my first or preferred language, I can use an interpreting service available through the NHS Inform helpline on 0800 22 4488. Language Line is available for all NHS helplines. Making decisions. I have the right to be involved in decisions about my care and treatment. I will be supported to take an active part in discussions and decisions about my health and treatment. I can ask NHS staff for more information to help me make decisions about the care and treatment that is available to me. The leaflet "It's OK to Ask" has handy tips and advice on asking questions. I can find it on the NHS Inform website. www.nhsinform.scot/campaigns/its-ok-2-ask. Or I can contact the NHS Inform helpline on 0800 22 4488. I can expect to be given enough time to make up my mind about any examination or treatment, including any extra time I might need for my communication needs, with the support of the NHS staff. I understand that in emergencies, decisions may need to be made quickly. I can ask for a second opinion before making a decision about my care and treatment, and, where possible, my request will be met. I have the right to accept or refuse any advice, care or treatment, examination, test or screening procedure that is offered to me, or to take part in research. To accept or refuse any of these, I must understand the information I have been given, and I must be capable of making a decision for myself. If I refuse any care and treatment, this will not change the way I access or receive care and treatment from NHS staff in future. Support when making decisions. I have the right to ask for support when making decisions about my healthcare. I have the right to be given information about support and any follow-up care that is available to me from the NHS and other relevant agencies. For example, local authorities, the Patient Advice and Support Service, and the voluntary sector. I can ask to have an independent advocate, representative, to help me give my views. I can ask to speak to a member of a spiritual care team. A member of NHS staff can arrange this for me. If there are times when I cannot make a decision for myself, I must still be supported and encouraged to be involved in decisions about my care and treatment. My will and preferences should also be taken into account. NHS staff who have to make decisions about my care and treatment may also consider the following. What is the best medical option for me? What I have said in the past about how I want to be treated. The views of others who are close to me. The views of my parent, guardian, or other person responsible for me if I am a child. The views of anyone who has legal authority to make a decision on my behalf. As a carer of an adult who cannot make decisions about their healthcare and treatment without support, I can expect to be involved in making decisions under the terms of the Adults with Incapacity Scotland Act 2000. The NHS Inform website explains the rights of people who cannot consent to, give their permission for, medical treatment and the rights of their carers. www.nhsinform.scot/care-support-and-rights/communication-for-carers-using-nhs-services/carers-and-consent. Or I can contact the NHS Inform helpline on 0800 22 4488. If I am under the age of 16, I can make decisions about my own healthcare and treatment, if the health professional looking after me believes I can make these decisions for myself. If I am a parent or legal guardian of a person under 16 who cannot make decisions for themselves, I can decide about their healthcare and treatment. The NHS Inform website explains how a young person under 16 should be involved in decisions about their healthcare and treatment. I can find out more at www.nhsinform.scot/care-rights/health-rights/communication-and-consent/information-for-young-people-using-NHS-services. Or I can contact the NHS Inform helpline on 0800 22 4488. Further support if I have a mental disorder. In this charter, a mental disorder means any mental illness, personality disorder or learning disability, which are the conditions that come within the definition given in the Mental Health, Care and Treatment Scotland Act 2003. I have a right to support from an independent advocate, a representative who helps me to express my views and make informed decisions. My mental health officer can arrange this for me. I can also find out more about independent advocacy in A Guide to Independent Advocacy, information for service users and their carers on the Scottish Government website, www.gov.scot. If I have difficulty making and keeping my appointments because of my mental health disorder, I can ask NHS staff about help to support me. If I need medical treatment under the Mental Health, Care and Treatment Scotland Act 2003, I can choose someone, a named person, to help protect my interests. I can find out more about named persons in the Mental Health Law in Scotland Guide to Named Persons Guide on the Scottish Government website, www.gov.scot. When I am well enough to do so, I can make a written statement setting out the care and treatment I would prefer or dislike if I become mentally unwell in the future. I can find out more about making an advance statement on the Mental Welfare Commission for Scotland website, www.mwcscot.org.uk. Or I can contact them direct on 0800 389 6809. If my mental disorder means I am a danger to myself or others, I might be detained or treated against my will. If this happens, I have rights, including having these rights explained to me. I can find out more about my rights from the Rights in Mind booklet on the Mental Welfare Commission for Scotland website, www.mwcscot.org.uk/law-and-rights/rights-mind. For more information about the rights of people with a mental illness, learning disability, dementia, or other related conditions, I can contact the Mental Welfare Commission for Scotland at Thistle House, 91 Haymarket Terrace, Edinburgh, EH125HD. Phone 0800 389 6809. Free phone number for service users and carers. Email inquiries@mwcscot.org.uk. Website www.mwcscot.org.uk. Managing my condition. I have the right to get support to manage my condition. For example, I can expect to be given information on how and when to take my medication, how to control pain, how to use any equipment I am provided with, and how to access other services that could help me. As far as I am able to, I will take responsibility for my own health and ask NHS staff involved in my care for support to help me manage my condition and lead a healthy lifestyle. I will discuss my care and treatment as openly and honestly as possible and tell NHS staff about anything that may be relevant to my care and treatment. This includes information about any changes in my health condition or any over-the-counter, herbal or alternative medication that I may be taking. NHS staff must make sure I have been given clear information about my condition in a way I can understand. Taking part in designing and providing local services. I have a right to be involved meaningfully in designing, developing and delivering health services in my area. This includes the decisions that significantly affect how services are run in the health board area where I live. My local health board is responsible for assessing the local community's health needs and deciding how best to use its resources to meet those needs. The board provides opportunities for communities, the public, service users and NHS staff to influence decision making. I can contact my local health boards to find out how to become involved in the development of my local healthcare services. I can get involved with Healthcare Improvement Scotland, community engagement to shape local services and make sure everyone's voice is heard. More information is available at www.hisengage.scot.